We're in the full swing of our Season 5. Global Health Matters continues to be a credible source as a podcast produced by TDR, a United Nations research program based at the World Health Organization. If you just found us, we have over 70 episodes for you to explore. You don't need to listen to them in sequence. You can look them up and choose a la carte topics and issues that most interest you. I promise you will want to hear them all. Welcome to Dialogues. I'm Garry Aslanyan. This is a special series of the Global Health Matters podcast. In this series, I'll be blowing open some of the echo chambers that exist in global health. To help me in this quest, I have invited thoughtful and inquisitive individuals from different walks of life. Each of them has explored and written about global health issues from different disciplinary perspectives. I hope this dialogue series will give you, the listeners, an opportunity and space to step out of your daily routine and contemplate global health issues through a different lens. So let's get started.
I looked at the square in front of me, illuminated by lights powered by the hospital generator. It was full of people. Some were writhing, suffocating, choking. Others, including children, were deathly still. I saw eyes full of fear, beautiful eyes, and cold dead bodies in the heat of August. They were all lying on the ground, some frozen, others blanketed in pain. Dear God, what was happening? Was the earth sprouting corpses, or were they falling from the sky? Those still alive didn't look like patients with localized wounds. This was something systemic. Their whole bodies were reacting. What was this horror?
For this dialogue episode, I'm joined by someone whose courage has turned a hospital basement into a symbol of defiance. I'm joined by Dr. Amani Ballour, a Syrian pediatrician. When the civil war started in Eastern Ghouta, Amani chose to stay. For 6 years, she worked in an underground hospital, treating the wounded, the starving, and the survivors of chemical attacks, all while becoming the first female doctor of a hospital in a Syrian war zone. She tells her story in her memoir, The Cave. Her story has also been told in an Academy Award-nominated documentary. She currently serves as Programme Advocacy Officer at the Syrian American Medical Society and as an adjunct assistant professor at Columbia University's Mailman School of Public Health. She has also briefed the UN Security Council on the humanitarian crisis in Syria. In this conversation, we hear about her first-hand experiences, explore what it means to keep a hospital functional under siege, and ask what accountability must look like for those who target health workers in conflict. Hi, Amani. Welcome to the show. Thanks so much for joining me today.
Hi, everyone. Thank you for having me.
Let's start by you maybe reading from your book.
We knew that the hospital, like many medical facilities in rebel-held Syria, was a regime target. That's why we didn't put patients in the floors above ground. It wasn't unusual for shells and missiles to smash through the upper floors, leaving sizable holes. Every time we were hit, we'd wonder if we should close the hospital. More than once, we publicly announced a temporary closure after an airstrike on the building. But people still turned up needing help, and we were going to treat them. The people kept coming, and we kept working. We never did close the cave, even temporarily, despite the danger.
That passage is incredibly powerful, Amani. Can you take us back to that night and what was happening? And What was going through your mind at that moment?
It was the worst night in all my time in Al Ghouta. It happened 2013. I can say at the beginning of the siege and the war, the bombing, the you know, uh, it was very bad. I was sleeping. Everyone was sleeping. People were sleeping hungry, they were scared, they know nothing about the future. It was like between 1 a.m. to 2 a.m. Uh, and yeah, we just got up very scared. We didn't know what happened. No one knows. We just heard very, noise and chaotic and we try to understand. I just got up, wear my clothes after someone knocked to my door, and all the people in the streets, were running, and they say chemical attacks, and we don't know what kind of chemical weapons they use. And to me, I never imagined that they would use chemical weapon against us. We were civilians, most of us. Some people were armed to protect, the cities and the place, but. Mostly civilians in the cities, a lot of children and women. And I arrived to the hospital very quickly and see a big square in front of the hospital, a lot of people lying on the ground. They were somewhere moving, some were dead. I don't know if they are dead or not. I was scared to see this. I mean, what is that? Something that I first time I see in my life. I don't know. Some people like throwing water in the bodies and on everyone. Some people trying to take off some clothes to allow people to take breath. I between I walked between these bodies, and I really didn't know what to do, how to start. I don't know how I become inside the hospital. It was underground, and see also a lot of people inside. The ground was full of people, like children, women, a lot of people. And I see some doctors of my colleagues starting, to try to do something. They advised me to start give people atropine, and we have only some, we tried, to start to give someone atropine to do, the first aid. What we learned to allow people to take breath. They have dark lips. They have a lot of secrets from their mouths and nose. They can't breathe. Some people were dying in front of us. I just, take a look in a room in the entrance of the hospital, look around me. The hardest thing was to choose how to begin. I mean, the people who we will start helping them, they will live, but other people, they will die. So we have to choose who's gonna live and who's gonna die, and that was very, very hard for us. I just, look between next to my feet. Some children sit in the ground, and I sit next to them and start working. And also the scariest thing to me, when some people saw me and said, "This is the pediatrician, bring the children here." And I really got very scared, because I wasn't a pediatrician. I was just start studying pediatrics. So I don't know everything, and I don't know what is this. So people start to bring the children next to me, a lot of babies. They were suffocating. A lot of them were dead. And I just, start to do what I learned, what I can do. Some people try to help. Everyone around us tried to help to do something. A lot of people died that night, a lot of children. And I remember all these children. It happened like nearly 12 years ago, but I can remember all the details at this night. I remember that father, like an old man, he came to me having his little baby, and he said, "Look at him, help him, try to save him." And I looked at him and I said, I was, in very noisy place, and I was scared. I was stressed. And I look at the baby, and he was dead. And he looks like, yeah, I mean, like not just dead. I mean, there was no way to help him. And I said, "He's dead. Let me help the others." And he yelled at me, and he said, "No, he can't be dead." I waited a long time to have this baby. I mean, he was an old man, and he waited a long time. And then he got this baby, and this baby was dead. I couldn't, try to say something to this dad, to help him, to support him. I was busy with others, trying to save other children. Now, when I remember this, I mean, I feel guilty. How can I say it to a man like this that your son is dead and just go. And a lot of people. I remember also a woman, I was treating her children, and she asked me to go with her to see her children. She said that three of her children were dead. Also, I couldn't go with her, and I can't, imagine how I did this. I mean, I couldn't just, a mother lost her three children. How I did this, how I didn't go with her. Still feel guilty about all these children, about the children who were a little far of me, and I didn't go to them and help them. So, a lot of bad memories. It's the worst night what happens. I couldn't imagine they use chemical weapons against the safe cities, safe people. I mean, innocent people, a lot of children. We don't know the exact number about the people who died that night, but there are a lot of people, like in the hospital, maybe 1,000 or more. I don't know. In one hospital, there's a lot, of medical points and centers. So it was horrible.
The civil war in Syria began in 2012, and before you even didn't finish the medical school, you finished later. And when you finished and qualified to be a doctor, you chose not to leave Syria, but to serve in an underground hospital in Syria. Maybe you can tell us about that hospital and what made you decide to stay and work in that hospital, Bani.
I saw people were in need of medical workers, of doctors, of nurses. A lot of doctors left, a lot of nurses, and some of them, the Assad regime arrested some of them and tortured some of them and killed some of them. I remember once they break into a hospital also next to our hospital, and they arrested the doctor and they killed a nurse there. So I see people need help. I mean, I saw them, I know them. They are my people, my neighbors, my community. I know they were innocent. They did nothing but ask for freedom. They protest and peacefully and ask for freedom, for some human rights. So I saw these people need help, and I decided to stay because I know I wasn't, well trained. I was just graduated, just started studying pediatrics. So I said, I know some information, a little train, I can help. So I believe that if we can help, we have to stay and help. This hospital was underground because hospitals were targets of bombing, of warplanes, and other, kinds of weapons.
Right.
So we decided to work underground. My colleague, Dr. Salim, started to open this place. It's supposed to be hospital before the war, but they couldn't complete it. So we started only to work in the basement. We cleaned it. We start working. Every day, every time there were bombing, there were casualties, there were injuries. So we started with very limited resources. We did what we have. I mean, we have some resources, some medical supplies. Started to make it a little bigger and bigger because the need was bigger. People were, also we didn't only help the casualties of the war. Also, a lot of people were sick because of the bad situation, because of the siege. There were no food, no vaccines for the children, no medicine. I mean, very limited. Like medicine and medical supplies and food. So we started to work there. Like for 6 years, we could make it a little bigger and bigger. Try to find some ways or other ways to get more resources, to get more medicine, to get more medical supplies. And we were able, to help a lot. And also a lot of people, we couldn't help because we don't, have the resources or have what they need.
And was there a day or a situation you can remember, like how exactly things unfolded? Let's say if there was really, I don't know, a patient, a child that needed attention and their condition, and what were the challenges when you were trying to help. Is there anything stand out you want to share with us?
I was working as a pediatrician in a small clinic in this hospital. I mean, in a room in the hospital. I wasn't a pediatrician, with my,
Right.
what I started to help. I remember, and the most thing I remember is many of the children who came to me, like suffering from something, the first question I asked them, what are they suffering from, what they have? They said, I'm hungry, I need to eat. Children, they just say what they feel. And that was very hard to hear from a child, because there were no enough food for everyone. I mean, I remember in between 2013, 2014, it was, the worst situation. There were no food before, we made the tunnels and we start to, smuggle some food. But children were really, really hungry. There were no baby formulas. I remember a young girl who have twins, two little girls, and she came to me many times, and I always like saw them dry. They just need milk, and I sent them many times uh, to the ICU for the children, and then they give them some milk, what they have, and they send them home again. But their mother couldn't feed them because she was hungry too. She has no food for her too. Also, she tried the cow milk a little with some water, but they didn't accept it. And I remember when they died. I mean, when first one died, and then 2 days after, the other one died in front of us, and we know they suffer from nothing, just hunger.
With the war going on, there were a lot of sort of barriers and probably checkpoints or blockades, and that probably affected a lot of the supply and really those basic needs like bread and milk that you mentioned and baby formula. Was there a way you found resources? You already alluded to that, but how did you manage on that side to kind of provide and serve the community?
Well, in the beginning, it was very hard. We used all what we have and everywhere, from the food to the medicines, the medical supplies. Started in 2013. Then I remember that winter, at the end of 2013, a lot of people died that winter, suffering from lack of medicine, lack of food. Then people started to plant some food. We can plant, in Al Ghouta. We used to plant, some food, but it wasn't enough. We don't have the resources also to plant. Like, we don't have the seeds. We don't have everyone, but we have some. So we start to plant something. I remember we lost the bread the bread is, the basic food for us. We lost the bread since the beginning of the siege. And then first the people make like tunnels to connect the Al Ghouta with the Damascus city, somewhere in Damascus. And they make some tunnels, and they try to start, smuggle some food first and smuggle some medicines and some medical supplies. With the years, tunnels become a little bigger and bigger. Sometimes we could smuggle some medical devices, and that was very good for us. When the Syrian regime discovered these tunnels, they bomb it, and then we make another one, and people try always. Actually, they were, the food that was smuggled by the tunnels was being sold in very high prices. Not everyone can afford it. It was, very hard to get it, but at least we have, some food for uh, for the worst cases.
Right.
But then we still, for example, the cancer patients, we have no medicine for them, no chemical drugs for them. I mean, no other, treatment for them. We could serve them nothing, actually. And a lot of them died because of the siege. They couldn't get out the Al Ghouta. They couldn't get the medication. So, yeah, a lot of them, I remember, they died. Some, special cases. Some cases of children, we couldn't diagnose it. We don't have also diagnostic like tools or something to know what they're suffering from. And I remember when that happened, when the UN came to Al Ghouta to us, and they came like 2 or 3 times, as I remember, and we asked them just to take some children with them. I mean, they are suffering, some cancer patients, some children that I said we couldn't diagnose them. And they just, look at them, say some words, and they went without doing anything for them. We were, waiting and waiting to help, but that was very hard. And in some time, the Assad regime allowed to sell us by the checkpoints by these what they call them war leaders or something. They sell us barley to make some bread. It's actually bad bread, but it was great for us to find something to eat. So we were eating that barley bread for like 2 or 3 years.
To something,
It doesn't, make the children or the people get weight, but it's good. I mean, you feel like you eat something. So yeah, and they sell at very high prices also. I remember like it doesn't like it's supposed to be 100 or 200 for 1 kilogram. They sell it 3,000 or something also. They were make it like a trade to send the bad thing they have and sell it to the people of Al Ghouta and get a lot of money.
Amani, you were the first female doctor in a way, and then you became the first female director of that hospital. Is that right?
First female doctor, manager of the hospital
In a war zone, yeah.
But in other places, in the cities, maybe you find females.
In other parts of Syria, yeah. How was that experience, Amani? I assume it's quite male-dominated environment. How did you feel being kind of in that role?
In the beginning, I thought that it's normal, it's okay to be a manager of the hospital. I mean, I believe that I can manage the hospital. I know the needs. I have plans, what we can, plans, what we can do, how we can improve the hospital. My colleagues also believe that it's okay. I mean, some of my colleagues, they believe that I can do it. But, actually, I kind of shocked to see some of my men of my community. They don't want me to be a director just because I'm a woman. They have no other reason. And this is not only for the old men, it's also for the young men. Some educated people, some of my colleagues were working together. I was like, as a pediatrician in my clinic, they said, it's okay, you can work in your room, but you don't manage the hospital. And I remember that educated guy, he was a colleague of mine, and he said, we don't want a woman to be our manager. He said it very frankly. I mean, I heard this a lot, and I wasn't happy to hear this. And, some people sometimes tell me that, they said that was a challenge for me, but I accepted to take this challenge. And I wanted to prove that I can do this. I can make the hospital better. I can do like other of my colleagues who are, good managers also, and maybe I can be better than. So I did my best to make the hospital better, to make everything done, to get the resources. And that was the hardest, thing, to get the resources, the medical supplies, the medicine, to keep the hospital, working. That was good. So yeah, I did my best, and I believe that I did a good job.
And with time, those who may have expressed those views directly to you, have they come around and changed their perception once you've been able to demonstrate your abilities? Did you observe anything like that?
Yes, and last time, before we left, many of the hospital, or I can say a lot, like 9% of the hospitals or the medical centers which people made underground in Al Ghouta were destroyed by bombing, or where they ran out of the resources. But our hospital continued working. We had some, I can't say enough, but we have good resources like serums, like medicine, like the most needed supplies. So yeah, I remember some of them came to me and they said, we were wrong and you did a great job and the hospital is still working. And I was very happy to hear that. I mean, I consider this like accomplishment, like I changed their mind. It's very hard, to change their mind. You don't know our community. They have these beliefs that women has to stay at home, that women, you can just work like a doctor, it's okay in your clinic, a teacher, but not other jobs. I mean, to be an engineer, it's, they don't like this. They don't like women to lead. They don't like to see women in positions. And unfortunately, still, I mean, look, a lot of these ideas improved with the time and they a little accept, but still, I mean, a lot of people, and if they hear this, they're not gonna like this because they criticize me always because I said this, but this is the truth, and people still don't like to see women lead. They don't like to see them in important positions. They don't believe in women, and this is the truth, as I said. But at least I changed some changed some mind, and a lot of women in Syria now are doing a great job. And before, during the wartime, they did a great job, and they were examples to for other women and for the men to believe that okay, we can do like your jobs and or maybe better.
And what was the proudest accomplishment that you can share? Maybe something that you did that looking back now, you'd say, that was my best time in that position, or I accomplished that. What would that be, Amani?
In that circumstances, that were very bad circumstances, I believe that, I mean, to keep the hospital working at, to the last point, to the last minute, it was a great job. I mean, to have the resources to help the people. I mean, I looked back and I remember a lot of people who were needed help. Maybe we didn't do the
Right.
best treatment for them, the best job for them, but we helped a lot of people. I mean, as a medical staff, the doctors there, I mean, the doctors did a lot of surgeries. I mean, sometimes it's, for really serious cases. We helped a lot of people, and the medical staff in general, save a lot of lives. There are some people who couldn't survive without our intervention. So yeah, I remember some cases, some people, some children who get better and who are now are in good situation thanks to the medical staff,
Right.
thanks to the cave hospital. And I feel happy when I remember
Mhm.
this.
Amani, could you share another passage from your book, please?
No therapy can make me forget my many painful memories. I would see the children from Ghouta in front of my eyes. I loved them. I vividly remembered the children of the chemical attack. I can't forget them, and I don't want to. To this day, the attack is a painful memory, but it's an important one because those children had voices and they were silenced. In Turkey, I would jump at the sound of a knock on the door. Thunder frightened me. Sometimes during storms, if Hamza wasn't home, he would call to tell me not to worry, that the sounds were thunder, not a plane. At night, I would hear the children calling out to me. There was Mahmoud, who asked me why I cut off his hand, not knowing that Shambo had sliced it off. There was a boy, Abdurrahman, who lost both legs when the regime shelled an elementary school. I saw the child in an ambulance and another wounded boy sitting next to him who was just silently staring at his classmates' bloody wounds. Sometimes I felt crushed by the memories.
How did you and your colleagues keep going through such unimaginable loss? And how have you reconciled those memories since?
We kept working, we kept going because people needed. Because, there's still people, nearly 500,000 of people where there are
Mm,
a lot of children. They needed us. And, we have solidarity. We support each other. When some of us, as we were like the medical staff and all the people in the hospital, we were like a family. We support each other. We listen to each other. Every time we have, I mean, some one of us like heard something or see a case and couldn't stand. We cried a lot. We were many different times we felt like we can't continue working like this, but we know we got support from each other. We heard from each other why it have meanings what we do. I mean, we remember our purpose from staying there. It was a great decision. It's a humanitarian. It's about people. It's about, this is the goal of being on this earth, to help each other, to have solidarity, to support each other. So this, make us keep working. We sometimes try to make, some jokes of our bad life, some jokes about the food, and we could laugh. We could have some parties also. So, as a human, we want to live, we want to continue. So yeah, and I think just being like a family, that make us, that make our situation better.
Right. In season 3 of this podcast, we had an episode again focused on health workers in war zones, and we discussed how health workers and hospitals have increasingly become targets in the modern warfare. And obviously, in the last few years, we see all the hotspots experiencing exactly same thing yet again. And I asked this question back of the guest we had, and I want to ask your view on that. Based on this experience you had, what needs to change to kind of protect people who are health workers like you at the front lines of the war and care? What would your message be?
What need to change is not just policy, but accountability. I mean, international humanitarian law is already protect the health workers and the medical facilities. Yet violations often go unpunished. There must be, stronger enforcement mechanisms, like independent investigations and real consequences for those who target the healthcare. Without accountability, we risk not only to lose the facilities, but also, to lose the entire generations of medical professionals. It's very important. And at the same time, health workers need better support on the ground. They need clear medical neutrality, and they need safe access corridors, for example. And especially, also very important, they need mental health support and like long-term investment in building trust between the communities and the health workers and the health system in general. I believe they must need to be trained, to be supported, and to be heard.
You've become a really courageous voice for Syria, and keep reminding the world with your book and the work you've done about what actually happened. And why was this important to you to tell these stories, and that people behind them are never forgotten? Why was this important for you, Amani?
Because silence allow injustice to be normal. I carry these stories because many of these people can no longer talk, can no longer speak. Some were killed, some were displaced, and somewhere, were silenced by fear. So remembering them is not about past alone. It's about dignity. It's about accountability and preventing repetition. This is the most important. So the people I speak for are not numbers or headlines. They are like families, colleagues, patients, friends. And keeping their stories alive is a way of honoring their lives. It's a way of protecting the truth and also reminding the international community of their responsibility. So it's very important to talk about these people always and remember them, remember their names until we got justice for them.
Thank you. Amani, Syria has had a change in the government, and there were elections or interim government at least been in place. What's your hope for the future of health system in Syria?
I hope Syria can rebuild the health system, rebuild the facilities, rebuild the destroyed hospitals and primary medical centers, and rebuild it with to be able to provide the medical services with dignity, to be safe, to be accessible and affordable for everyone. Regardless their location, regardless their background, to be available for everyone, to be affordable, as I said. and to focus on the medical professionals, as well the patients, but also medical professionals, the medical workers to prioritize them because they need help to support them, to focus on their mental health. And this is the most important, to a health system, to treat also, people in Syria after all this suffering. So we need to treat not only this healthcare system support to heal not only like the physical injuries, but also the deep trauma they left by the years of the war.
Thank you, Amani, for sharing the insight into your book and some of the situations that you've described in that. I wish you best for your future endeavors, and thanks again for joining the show today.
Thank you so much for having me. Thank you for talking about Syria.
Speaking with Amani left me profoundly surprised, not just by what she witnessed, but by her clarity about why she continues to speak up. First, Amani reminds us that silence is not neutral. When we fail to name what's happening in Syria, Gaza, Sudan, Ukraine, and Iran, we allow injustice to become ordinary. She speaks for those who no longer can. Second, she shows us that solidarity is what sustains people through the unsustainable. The cave hospital survived because its staff became a family, people who cried together and then went back to work. And finally, Amani urges us to move beyond policy and demand accountability. International humanitarian law already exists. What is missing is the will to enforce it. I hope this dialogue strengthens your resolve to stand with those on the front lines of care. To learn more about the topic discussed in this episode, visit the episode's webpage, where you will find additional readings, show notes, and translations. Don't forget to get in touch with us via social media, email, or by sharing a voice message. And be sure to subscribe or follow us wherever you get your podcasts. Global Health Matters is produced by TDR, a United Nations co-sponsored research program based at the World Health Organization. Thank you for listening.